Well, I'm a little uncomfortable.
You are. I understand that you had a little bit of abdominal pain and you fell down at home.
Yeah, I guess I did. I passed out when I fell down. But I do have the pain over here under my right rib cage. And it's, oh.
Do you remember meeting me when you first came in the ER? You're a little bit in a lot of pain. My name's Michelle.
Yeah, okay.
I'm going to be your RN.
Good.
All right, how's your pain level right now?
1 to 10, probably 5,
About
6.
a 5? Okay, what does it feel like? What's the pain if you got to use an adjective to describe it?
Well, it's just like a dull ache over here under my rib cage, and I haven't any idea what it is or what it's caused. I had cardiac problems in the past, but that's all on the other side.
Did they do an EKG yet when you came in? I know we always do that within the first 5 minutes of admittance.
But it was normal.
It was normal? Very good.
Not having any of the symptoms of the cardiac problems.
Very well. Alrighty. Well, we're going to get you some pain medication, and I'm going to start an IV. And the excellent Dr. Ibanez will be coming in just shortly to assess you and speak to you further about your CT results.
Okay. Thank you.
You're very welcome.
Horace, good morning. I'm Dr. Ibanez. How you doing this morning?
Well, not as good as I'd like to be.
I heard, I know you've told this dentist story a couple of times. What happened this morning?
Well, I was feeling uncomfortable, and then I got a little dizzy, and I guess I passed out on the floor.
Okay.
And wife called 911. And I've had this aggravation over here, discomfort under my rib cage for 2 or 3 days, and I thought, well, maybe I bruised it bending over or something, but it didn't want to clear up. And this morning's the first. I've been a little nauseated, but this is the first time I actually passed out.
Had you had any vomiting or any diarrhea?
No, I haven't had much appetite, so I haven't hardly eaten anything.
Okay. All right. All right. And I understand you already got your CAT scan done and all that, so I'm going to examine you. You tell me where it hurts. Does it hurt over here on this part?
No.
Does it hurt down here?
A little bit.
Does it hurt up here?
No.
Does it hurt here?
Yes.
Right under your right rib cage?
Yes.
Oh, okay. All right. And any allergies?
Only tetanus.
Any other medical problems other than your heart disease that I read on your chart?
No.
No? Okay. I know that the nurse started the IV, get some pain medication. You're feeling a little bit more comfortable now?
Yeah.
Okay.
I'm starting to ease up a little bit.
Good. All right. I'm going to see if the CT scan results are back yet, all right? They should be done shortly. Meanwhile, if you need anything, let the nurse know and she'll let me know, and we'll be sure to help you out, all right?
Okay. Thank you very much.
Take a look at the CAT scan right now, I'll let you know, all right?
Okay.
Good. Hi, how are you?
Hi,
How you
Doctor.
doing? I'm Dr. Ibanez. You got the CAT scan done yet?
Yes.
Okay.
Hi, Mr. Warner. I'm an X-ray technologist, and I'm here with the results for the doctor. Dr. Meng had said he had gallstones in
Did
his
he?
CT scan.
Okay. All right. Apparently you may have some gallstones in your gallbladder. That may be causing the problem. So if we see here, I'm looking at the CAT scan right now, and I can see the liver is on this side right here. Your heart is here. And then there's this very bright, like 4 or 5 bright circles on this part of the CAT scan and on this one as well. Those are very compatible with gallstones. So your problem is you probably have some, what we call an acute cholecystitis or inflammation of the gallbladder secondary to the gallstones, and that causes a lot of pain. So you're probably going to need to have a surgery done.
Okay.
All right? So what I'm going to do is I'm going to get in touch with Dr. Wallace, our surgeon on call today, let him know what's going on, and then we'll take care of your problem, okay?
Appreciate it.
All right, you have any questions right now?
No, just as long as I get comfortable,
Oh.
get this out of the way.
No problem. The easy thing is to get rid of the pain. We need to figure out how to take care of your problem so it won't happen again, all right?
All right.
Okay.
I'm Michelle. I'm an ER nurse. And today I acted like I was a recovery nurse as well, but I'm working the ER here. I decided to be an ER nurse after my father turned really ill when I was in high school, and it was a really helpless feeling. I couldn't really take care of him, and it was our family didn't really know who to turn to or a lot of the technical lingo that a lot of the physicians were talking about. So I decided right then and there, like, that I wanted to not have that helpless feeling again, and I wanted to be able to help my family if in need. And I also saw the way the nurses and physicians were helping my father at that time, and I wanted to be able to do that for other people in the community. So that's actually what got me into the field. And the ER was the last place that I thought that I would want to work. I remember telling my teacher during rotations, like, don't put me in the ER. That's the last place I want to go. And you can skip that rotation and put me in somewhere else. And he said, no, everyone has to go. We do the rotations everywhere. So I went, and then around lunchtime he came in, and it was actually in here. He came around lunchtime. He said, how's it going? And I said, it's awesome. I love it. He said, I know that you'd like it. I think this is the spot for you. And he was right. I love it. Every day's different. Every day, you never know what's going to come in the door at any minute. You have to be prepared for anything. At 1 minute, there could be nobody in the ER, and the next minute you can have a trauma case. You can have somebody having a heart attack, a stroke, anything. So you have to be on your game. You have to know all the up-to-date medical techniques, devices, everything that's going on in the medical field. So it's good in that aspect. It kind of makes some people really nervous because it is so high energy, and it's go, 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 go for 13, 14 hours a day. So, but I do love that, and it's really rewarding to see a family come in and be able to help them and their family members. So that is very rewarding. I encourage all of you to, if you are interested in the field, don't be discouraged by it. Oh, it's a lot of studying, and it's a lot of homework and this and that. If I can do it, and with my undiagnosed ADD, anybody can do it. Trust me. I am so all over the place, and I can't believe I was actually able to sit down and focus and study for. I study hours a day. So if I can study and focus, anybody can. Trust me.
Hey, Mr. Warner, how you doing, buddy?
Well, better than when I came in.
Okay, good. Listen, I'm Dr. Wallace. I'm a surgeon. The reason I'm here is because Dr. Ibanez and his crew made the diagnosis of acute cholecystitis. Sounds like your gallbladder's infected.
Okay.
Does that make sense?
Well, if that's what's causing the problem.
All right, perfect. And listen, they're going to pay me a lot of money to take your gallbladder out. Does that sound okay with you? It better be, because if you don't, you're going to be in trouble. Listen, if we don't take out your gallbladder, okay, it could perforate. If it perforates, you can die. Okay, so I've already mobilized the operating room team, and we're going to come in, we're going to get together, we're going to take that out. I'm going to do that laparoscopically, 4 small incisions with cameras and scopes. 95 to 99% of the time it goes great without any problems. 1 out of 100 times we have some problems, but I don't think that's going to happen today for you. Does that make sense?
Good.
You have any questions for me?
No, let's just get on with it.
Okay, let's do it. Okay. I've been a surgeon for about 9 years, 10 years. I went to high school around here in Orange County. I went to UC Riverside for college. I wanted to be a physician ever since I was 6 years old. At least that's what my mom's been telling me. Then when I was in high school, I thought I would do a pre-med major. I thought I'd be a physical therapist or I'd be a physician. I thought the two were noble fields and I would be good at both of them and I'd be helping people. Someone made the mistake in college of telling me I wasn't smart enough to go to medical school, so then it just became a vision quest, and it was very difficult and very challenging, but I proved I could. And then at the end of college, I decided what I was going to do, and I chose to go to medical school. I think one of the fallacies that I would always hear is, oh, you're going to be a physician, you're going to medical school, you must really love study, you must really love school. The truth is I don't. I do enjoy learning, but I wanted to help people. I wanted to be a physician like Dr. Ibanez. I needed the tools to do that, and I was going to do whatever it took. I finished college, I think, with a 3.8 or a 3.9. I studied very hard. I studied about as hard as you can do, because that's what I wanted to do with my life. And I would probably tell most of the people here, if you're going to be successful at anything that you do in life, you're going to have to work hard.
Give you all of those kind of drugs I carry, and off to sleep you're going to go. Sometimes you have very nice dreams with anesthesia, and I'm hoping that you will awaken having had a very nice dream. Here we go, off to sleep.
Jen, you guys ready for me? Got my stuff?
Do it.
For monofilament through a PDS.
Got it all.
Martine Epinephrine.
True.
Is Dr. Skinner awake?
All right.
Not too much.
Here, still awake.
Hold on, let me get a phone call. We got the ER on the line.
Sorry, guys.
Keep everything sterile, okay? Perfect. All right. Okay, I'll take a left leg. Okay, top it, top it. Here we go. Okay. Focus the camera. All right. Great.
Nice.
Here we go. Perfect. I don't know if the overhead lights are maybe too bright, maybe we get a better picture. Drop those. All right, there's a gallbladder. Okay, moving it up a little bit. Put him over the trocar. Great. Okay, this bad boy looks still nasty. Nothing we can't do. What's the cautery on?
30.
Okay, can you put it down to 25, please?
Cutter at 25.
Great.
Nice.
Okay.
Becoming quite skilled.
There we
after the
go.
last-
Well, every once in a while I can do this thing. Nice. Okay, can come in with the camera? Perfect. Oh,
Oh,
hey,
can't see.
lights down. All right. Nicole, don't do that again.
Yeah, that's well.
All right, perfect. Okay, there we go. Give me a little more heat on the pottery.
Up to 30.
Fire that bad boy up.
Nice, Nicole.
Okay,
Yeah, better.
there we go. All right, that's the liver. I'm just slide the liver away a little bit. We got the gallbladder on the top left. And below me is the common bile duct, which we don't want to injure. Nice. Okay, let me see the back side. Yeah. Good. Perfect. Great. Let's get the lymph node out of the way. Let's just slide that up a little bit.
Get that liver, doctor.
That's
I'm
not
gonna
good.
heal one
That's
from
not
now.
good. Perfect. I think he's waking up a little bit. Just kidding.
All right.
Good job.
Medication here.
Mr. Werner, you're going to be fine. Go back to sleep, buddy. Your operation's almost over.
Don't remember a thing.
You're very sleepy. Great. Okay, so let's break down some of those connective tissue attachments. All right, let me have Marilyn, please. Nice. Okay, a little focus. That's too close. Okay, yeah, thanks. Back it up a little. All right. Yeah, oh yeah. So let's move that lymph node up a little bit. Let's see if we can get the dissect out that cystic duct a little bit better. Before I divide this, I need to make sure we have the right structures here. All right, so there's the artery. We can see that's a little bit higher, and I got the cystic duct is medial towards me. Got a little punch, nigger. All right. Okay, let's check out the back side. You have the hook ready to go again?
Yes.
Nice. Okay, let's admire my work a little bit. Hey, don't go with that again. Grab it again.
Mr. Warner. Mr. Warner, you're in recovery now. Surgery is all finished. Everything went great. Mr. Warner had a laparoscopic cholecystectomy.
How my brother did.
He was great.
Pretty good, though.
Yeah, he was pretty good. He was a little worried at first, a little shaky, but he did what he was supposed to do.
Okay, good. Good. Very good.
So he has marking 40% with epi. We gave him 50, which is around the incision site. He just has dermal bottom on his belly for adjusting.
Okay.
Not complaining of any pain yet, so probably will keep some belly. But in that, he's doing great. He's got fully sequential tattoos on his legs. So ready. IV's still doing great.
All right.
How are you feeling, sir?
Much better, much better.
All
A
right. Are you
little
gonna-
woozy, but better.
Any nausea at all?
No.
Did you vomit at all afterwards?
No, nothing.
Nothing on your side?
Nope.
No accidents?
No,
Okay,
okay,
good.
good. All right, you're in good hands here, okay?